from the station that's on your side. This is Channel 7 News Daybreak.
It's finally getting to be that time of year when you can truly put on shorts, enjoy the outdoors, but with all that sunshine, we have to remember our sunscreen. And for some of us, remember the poison ivy. Baptist Health's Dr. David Gerson with Sherwood Family Medical Center is here to make sure that you are summer itch free. Dr. Gerson, good morning to you. Good luck with that. We're an outdoor state. I mean, that's always been known. People love to go camping, hiking, fishing, etc. And to get to those locations, a lot of times you have to get through the green stuff, and that could cause this.
Yeah.
This is what exactly? Poison?
This is poison ivy.
Ivy, okay.
But,
all right.
But, you know, let me step back.
Okay.
This can be caused by any of the big three, the poison sumac, the poison oak, or poison ivy. This is just the way the skin reacts when it's exposed to that oil that's on that plant.
Okay.
Okay. And this is one of the more severe cases. We would certainly want you to come and see the doctor if it was to this level here. This is a little bit probably more what people are familiar with, kind of that streak that goes across the hand, the plant that rubs across the hand.
Okay.
And then, yeah, this sucker's blowing up. And so, again, you want to see the doc for this as well.
Let's talk about poison ivy in particular.
Sure.
And this is a couple other pictures. This is which one?
Well,
sumac?
this is sumac.
Okay, this is sumac. This is
oak.
Okay. And here is...
This is the devil, poison ivy. It's the devil itself.
The horns on each side and the face. Yeah, the three leaves.
It's interesting, one little side tidbit. This was actually considered a decorative plant many years ago. Thomas Jefferson actually planted this all around the White House.
What?
Yeah. I'm starting to think they need to replant it.
Yeah. Yes,
anyway, we digress.
Yes.
So this is the poison ivy. Remember the leaves of three, stay away from it. What's really challenging with all these three plants is they're great masqueraders. They hide amongst other bushes and vines. Real commonly here in Arkansas, the Virginia creeper, which we're all pulling out of our azaleas and our rose bushes. These plants like to sleep with those things. They kind of curl around them. So you got to be real careful about looking out for this.
Okay, so this is something that can just happen, and it's just a brush of the skin, right? It's not even rolling around in it. I mean, truly just brush by the arm or leg, and all of a sudden you get the reaction.
As well as if your dog's running through this, and then you pet your dog.
Really?
Yeah. It's the oil. You just got to watch out for it all times.
Okay. So when do we go see the doctor?
Yeah, so generally speaking, trying to get to this as soon as possible. Certainly what we talk about is a window of 4 days. So if you're still having these rash symptoms and it's 4 days, get to see the doctor, because then it becomes systemic. This means that you're going to have rashes pop out in places you didn't even touch, because it's going through your bloodstream. Okay. If you're having the lesions that are looking like they're getting infected, certainly we want to see you. Or if it's just so painful and so uncomfortable, come to see us, because we have some additional treatments that we would use to help kind of get the symptoms go away a little quicker.
I know that we have a couple real quick to mention. These are some topicals.
There's several here. So this is good old Caladril. This is a mixture of calamine lotion, the pink stuff, with some Benadryl in it. And what's important to tell patients is don't take a little cotton swab and be namby-pamby about it. I want you to put this in your hand, and I want you to goop this over. Lather it up. And the other one, this one here, this is a preventative. So this is technically, there's one called Zanfel. This is a scrub that you use in the shower, and I would recommend having this in the home. Don't get this after you've got the rash. Get it if you think you've been exposed, and certainly it's not a bad idea. If you've been doing a lot of heavy gardening, out camping, get into the shower, scrub this down, and this will deactivate the oils to help to prevent the rash altogether.
Hopefully you are summer itch free, and hopefully Dr. Gerson helped this morning. Thank you so much. But we know that it'll still happen, because like you said, it's everywhere.